very comprehensive management program that takes care of the athlete from the moment they get concussed on the field, with our athletic trainers being the first line of defense, to coming to the office, to being managed from their scholastic return to the classroom back to the field of play. A concussion is a traumatically induced disturbance of brain function that involves a complex pathophysiological process. The first subset of symptoms are physical symptoms such as headache, pressure in the head, sensitivity to light, noise, difficulty with balance, neck pain, and dizziness, or just a general feeling of a headache that gets worse with mental or physical activities. Another subset is cognitive. They feel slowed down, foggy, confused. They have trouble focusing, concentrating, trouble learning new material, difficulty focusing specifically on class. Another subset is sleep. A lot of athletes that have concussions have the need for more sleep, or sometimes the need for less sleep, or the inability to sleep effectively, whether they have trouble falling asleep or trouble staying asleep. The last is the emotional subset. They feel nervous, more emotional. They feel sometimes anxious or agitated. Most athletes will have symptoms right after the trauma, but the small percentage will have symptoms come on relatively delayed. There are definitely signs and symptoms that you want to watch for that are more worrisome in the first 24 to 48 hours. An inability to recognize people or places. They feel agitated. They could have severe or worsening headache, prolonged loss of consciousness, neck pain, numbness or weakness, seizures or convulsions. Those are things that we can't see on the sidelines, we can't see on the court, but those are things that we have to be aware of, because if there is worsening symptoms or worsening signs over the course of 24 hours, then you can take them to the emergency room. CT scans and MRIs do not help in the diagnosis of concussions, but they help rule out brain bleeds. In the first 24 to 40 hours, it's important for them to get adequate rest. One of the things that used to be told to parents was that you want to make sure you wake them up every couple hours to make sure that they're awake. We want them to rest, but it's okay to go and open the door and make sure that they're breathing in the same pattern and they don't look like they're restless or agitated when they're trying to sleep. We don't want to give them any anti-inflammatories like ibuprofen or naproxen sodium or aspirin, because we don't want to mask their symptoms. The first 24 to 48 hours, we try not to get them to go to school if we can, because that's typically going to exacerbate their symptoms. We advocate for appropriate mental activity during that time, making sure that the athlete is not having excessive time on their phone or on video games. So we try to pace them and tell them not to push themselves throughout their symptoms. It's very important to do continuous monitoring of them to make sure that they're progressively making a recovery. We approach the return to play as return to learn first. We're looking for that just right amount of activity level to not produce symptoms. When they return to school, we find that it's easier for athletes to go to classes that they can tolerate, maybe take a couple classes off, go rest, and then go back to the second one. We know that gradual return works. We talk about different phases of return to play: light, moderate, higher intensity exercise, and then more sport-specific activities interspersed in between that before they return to their contact activity. So we take them through these different phases, typically under the guidance of their athletic trainer, but sometimes it's on their own, depending on their access to their athletic trainer. We have a very comprehensive approach to evaluation. We want to know how many symptoms did they have at the time of the injury and how many symptoms did they have at the time of the first evaluation. There are a bunch of different neuropsychological tests that we can do to the athlete. The C3 application was born of the idea of monitoring balance in a very objective format. The C3 test has different processing speeds on it, different reaction times, and some trails testing where the athlete is actually able to connect the dots on the iPad. Our physical therapists or vestibular therapists, they work with balance and coordination. We have optometrists that we utilize that specialize in concussion management and vision therapy. Some athletes have a lot of emotional issues stemming from their concussion. Those athletes are best served by seeing one of our sports psychologists and potentially our psychiatrist as well. We want to make sure that they are cleared on all different parameters. Everything that we see and everything that we measure, we can make sure that they are back 100% before they step back on the field and take the risk of getting another injury. What we've learned after seeing thousands of concussions is that each concussion is individualized. Each person is treated individually. We see a lot of athletes across the region that come to us for their management and their return to activities. We have numerous sports medicine physicians and subspecialists across our Cleveland Clinic enterprise that are going to be in your community, right in your neighborhood, that can help with the recovery process of getting the student athlete back to their student activities and back to their physical activities safely.